If you've ever felt burning, tingling, or strange nerve sensations in your feet at night and wondered why it keeps happening, there's something very important you need to understand. Because for many adults over 50, the discomfort in their feet is not random and it's not simply getting older. In a surprising number of cases, there is a hidden connection between those nighttime nerve sensations and blood sugar health, even in people who have never been formally diagnosed with diabetes. And today, I want to talk with you about that connection in a simple, calm, non-alarming way, because once you understand what might be happening inside your body, everything starts to make much more sense, and you can make smarter decisions about how to support your feet and your nerves. Most people are never told this. They're simply told to watch it, or it's normal with age. But what I've seen over and over again is that these sensations often have a logical explanation. Your body rarely does things randomly. When something feels different, there's usually a reason. And when you understand that reason, you stop feeling helpless and you start feeling in control. That's the goal here today. Not fear, not complicated medical talk, just clarity. Hi, I'm Dr. Alan Brooks, and over the years, I've spoken with many people who describe the exact same pattern. They say their feet feel strange at night, sometimes hot, sometimes numb, sometimes like tiny electric shocks or pins and needles. They try changing socks, they try rubbing their feet, they try different creams, but the sensations keep coming back. And when I ask them about their overall health, very often we discover something interesting. Many of them have elevated blood sugar, prediabetes, or long-term metabolic issues they didn't realize could affect their nerves. And that's when the light bulb goes on, because the feet are often one of the very first places the body shows signs of nerve stress related to circulation and blood sugar changes. What surprises people the most is this. Many of them say, "But doctor, I don't have diabetes." And that's exactly the point. You don't need full diabetes for nerves to feel stressed. Even small fluctuations, slightly higher sugar levels, or years of borderline numbers can slowly affect the smallest blood vessels in your body. And those tiny vessels are exactly what feed your nerves. When that supply becomes less efficient, the nerves become more sensitive. And sensitive nerves are noisy nerves. Let me explain this in a very simple way. Your nerves are like tiny communication wires. They carry signals from your feet to your brain and back again. For those wires to work properly, they need steady oxygen, good circulation, and balanced nutrients. When blood sugar stays high for long periods of time, even slightly high, it can slowly irritate those delicate nerve fibers. Think of it like sugar acting almost like a slow rust over time. It doesn't damage things overnight. It happens gradually, quietly. So quietly that many people don't notice until symptoms finally appear. And by then, they feel confused because they can't remember when it started. One of the earliest places this shows up is in the feet. And there's a reason for that. The nerves in your feet are long and thin. The longer a nerve is, the more sensitive it is to circulation problems. So when blood flow isn't ideal or nutrients aren't delivered efficiently, those long nerves are often the first to complain. That complaint shows up as tingling, burning, numbness, or unusual temperature sensations. And because you're more aware of your body at night, those sensations feel stronger when you lie down to sleep. During the day, your brain is distracted. You're moving around, talking, watching television, working, thinking about errands and responsibilities. Your brain filters out minor discomfort automatically, but at night, everything gets quiet. No distractions, no noise. Your brain suddenly turns its attention inward, and those same mild nerve signals that were barely noticeable during the day now feel amplified. It's almost like turning the volume knob up. Nothing actually got worse in that moment. You're just noticing it more. Now, here's something important. This doesn't mean everyone with burning feet has diabetes. Not at all. But it does mean there's often a connection between nerve comfort and metabolic health that many people overlook. Even people with borderline blood sugar or mild insulin resistance can notice nerve sensitivity. And many adults live in that gray area for years without realizing it. That's why paying attention to daily habits that support circulation and stable blood sugar can be incredibly helpful for overall nerve comfort. For example, what you eat during the day can affect how your feet feel at night. Meals very high in refined sugars or heavy carbohydrates can cause blood sugar spikes and crashes. Those swings put stress on your entire system. And that stress can show up as inflammation or nerve sensitivity. Many people tell me they notice their feet feel warmer or more restless after heavy meals, late night snacks, or sugary desserts. But when they eat more balanced meals with protein, vegetables, fiber, and healthy fats, their body feels steadier. And steadier often means calmer nerves. Movement also plays a huge role. Gentle walking, stretching, and light activity help keep blood flowing to the extremities. Blood flow is how oxygen and nutrients reach your nerves. When you sit still for hours, especially in the evening, circulation naturally slows. And slower circulation means less support for those nerves. That's why even short walks around the house, light ankle rotations, or simple calf stretches can make a difference. You're not trying to exercise intensely. You're simply keeping the system active and nourished. Hydration matters too. Many people underestimate this. Your blood is mostly water. When you're slightly dehydrated, your blood becomes thicker and circulation becomes less efficient. That means less oxygen delivery to the nerves. Something as basic as drinking enough water throughout the day can support better circulation and better nerve comfort. It's such a small habit, yet it affects everything. And then there's daily internal support. Because while food, movement, and hydration help from the outside, nerves are living tissue that also need consistent nutritional support from the inside. That's why many people choose to add a simple daily nerve support formula to their routine. Nothing complicated, no mixing powders, just easy capsules they can take with water. The goal isn't instant results. The goal is steady support over time, and nerves respond best to consistency. I actually recorded a short presentation explaining one of the options many of my patients prefer because it's simple and fits easily into daily life. In that video, I walk through how internal support works, what ingredients to look for, and why so many people choose this approach alongside healthy habits. If you'd like to learn more, you can find that presentation in the description and the pinned comment below this video. Watch it whenever you have a few quiet minutes and see if it makes sense for you. But regardless of what you choose, remember this: your feet are messengers. When they feel irritated, they're giving you clues about circulation, metabolism, and daily care. And the earlier you listen, the easier it is to keep things comfortable. Small, consistent habits almost always work better than dramatic fixes. If this helped you understand what might really be happening and gave you a few practical ideas you can start using today, consider subscribing. I share simple, realistic guidance like this regularly to help you stay comfortable, active, and confident on your feet. Take care of your health, take care of your feet, and I'll see you in the next video.